Thank you, Gary. I'm going to have to definitely read from my notes because I have a lot of stats to share. As we come together today to celebrate the anniversary of Medicaid and Medicare, I want to highlight what's possible for us in the future, especially given the progress we've made just this week in Congress. I'm going to speak towards prescription drugs mainly here. Year after year, in fact, several times a year, media headlines always seem to announce that drug makers are hiking prescription drug rates, right? Journalists, here's my first set of data. Journalists reporting on prescription drug price increases, they say this year's price increase were comparable to last year's and the years before. And okay, so there's price increases. 4 out of the top 10 prescription drugs in the United States have increased by more than 100% by 2011. Brand name drugs are increasing more than twice as fast as inflation. So if we talk a lot about inflation, right? Think about that. Prescription drugs are increasing even at a greater rate than our current 40-year high of inflation. Prescription drug companies have raised the prices of their products almost 1,200 times in the first 7 months of this year. More than the same period in 2020, more than the same period in 2021. The skyrocketing high prescription drug prices obviously hurt West Virginians every day and in every way, right? 24% of all West Virginia adults under age 65 do not take medications as prescribed due to the high cost. Certain groups are obviously more likely to report difficulty. 49% of West Virginians report being in fair or poor health. 49% of those are skipping their needed medications. With constant headlines of ever-rising high prescription drugs, it is not surprising that the voters of both parties, Republicans, Democrats, and Independents, I'll give you some numbers here in a second, are ready for Congress to pass legislation to curb drug prices. You know, and it's a time of a lot of division within our Congress, within our neighbors, within, our own families. But congressional action on prescription drug prices has overwhelming bipartisan support. There's a poll here by the Kaiser Family Foundation that shows nearly 9 in 10 Americans want the federal government to negotiate for lower prices on medications. That includes 77% of Republicans, 89% of Independents, and 96% of Democrats. We haven't had this kind of bipartisan support for anything healthcare related in years, right? An overwhelming majority, 72%, support giving Medicare the power to lower prescription drug prices. So it's time for some new headlines, right? It's time to, while we're celebrating the anniversary of Medicaid and Medicare, to also say that's great. 57 years of these programs have been amazing for Americans and for West Virginians, but we can do more. We should do more. American people want more. The voters want more. The citizens, everybody wants more. And apparently our congressional delegation does too. So here's some of the things that Congress is actually in the position after this week to really carry home for us. By 2023, barring drug manufacturers from increasing prices for drugs faster than general inflation for all Medicare covered drugs, which essentially is all U.S. covered drugs and the prescription drugs. All right, to extend the advanced premium tax credits for West Virginians purchasing health insurance on the marketplace. That is at least 23,000 West Virginians that will benefit from this. By 2025, capping the annual out-of-pocket costs for Medicare beneficiaries at $2,000. Currently, they're unlimited. Beginning in 2023, here's a big one. Medicare will, for the first time, have the power to negotiate the price of prescription drugs. And this matters not just for those on Medicare, but for everybody who needs prescription drugs in the U.S. And, you know, we've heard some... And we've heard, you know, talk about how we're going to pay for this. What's the pay for? These provisions will actually save Medicare $300 billion. It's not taking away from the program, it's helping it. It's helping all of us. And here's the headline for drug companies. West Virginians aren't easily fooled by your millions of dollars in completely false advertising that has been flooding our state around this issue. Woo! The ads claim, you know, and using, quite frankly, some menacing language, that any regulation of prescription drug prices will end drug research and West Virginia won't get the drugs we need. This is false. And you know, we as a group, we know the BS when we hear it, right? West Virginia voters actually have a very low opinion of pharmaceutical companies. 69% of us hold an unfavorable opinion, and 85% of West Virginians think prescription drug prices are too high. So I would like to give a quote here that I have from Timothy Lash, president of the West Health Policy Center. The pharmaceutical industry has tried to instill fear in the American public that federal legislative proposals to reduce drug spending would threaten access to innovative life-saving drugs. West Health and Johns Hopkins findings clearly refute that claim. Large drug makers are so profitable they could maintain their current investment in research and development, R&D, and their standing as the most profitable industry, even if they lose significant revenue. So we're not losing out by negotiating. Our drug pharmaceutical companies, they're not losing out either. They still have all the capacity for R&D. In fact, the federal government pays for most of the research and development. So, you know, in conclusion, I guess I would like to say that Congress has been making headlines this past week about the ability to change life for West Virginians. And I would like to say that, you know, on the 57th anniversary of Medicaid and Medicare, that we recognize that these programs are essential to West Virginians and that we can build on them and do more. Thank you. Woo.